Cyriax. What's the first thing you think about? Perhaps friction massage. Well, indeed, we're going to study a lot of different friction massage techniques, which mostly are quite easy and are mostly also quite combinable with other techniques. But besides friction massage, we also concentrate on manipulation, mobilization, traction. But those techniques are not the most important issue. The most important issue is clinical reasoning, diagnosis. Now, what's the point of performing some treatment technique if we don't have a to-the-point diagnosis? So we're going to focus a lot on the clinical reasoning process. Clinical reasoning. Well, let me give you one example. We can ask ourselves the following question. Can we make, at this moment, the clinical distinction between, for example, a supraspinatus tenoperiosteal tendinitis lesion, or a deep acromioclavicular lesion, or traumatic arthritis in the shoulder, or a chronic subdeltoid bursitis? Well, this is an important question because the clinical image of all those lesions is totally different, but also the treatment procedure is totally different. So this kind of clinical reasoning process, by using standardized examination protocol, for this purpose we developed the Cyriax assessment form, is going to be quite important. The ETGOM training program in modern orthopedic medicine has several advantages. Just surf to our website cyriax.eu to discover those advantages. Modern orthopedic medicine. Well, what's the value of modern orthopedic medicine? Just let me give you one example. Just imagine we have a course group, 16 participants and 1 patient. And we have to do one little exercise. We have to check the segmental mobility between L4 and L5 by using palpation techniques, and we write down on a paper what exactly we feel. Well, what is going to be the result? At least 10, 11, 12 different opinions. So honestly, we can ask some questions about the relevance of those kind of procedures. And this is exactly modern orthopedic medicine, to make the difference between relevant clinical reasoning and less relevant clinical reasoning. During the years, we also optimized a lot of treatment techniques. We optimized it for the patient. It became more patient-friendly. Some techniques became more therapist-friendly. We also abandoned some techniques which were used in the past. We don't perform anymore for several reasons. There's also solid scientific proof for some hypotheses which were put forward in the past, and hypotheses which are not valid anymore, well, they are thrown out. So there's a nice, clear, positive evolution in modern orthopedic medicine. Discovering and analyzing clinical images, this is still my passion in clinical practice, and I hope one day you will discover the same passion together with me. Well, perhaps one day we will meet on one of our courses.